Now, how to track your period means what is your fertile period, what is the unsafe period, and fertile period means unsafe period, and what is your safe zone where you don't have to worry for conception. So, as a gynecologist, I get both types of patients. For an infertility specialist, my patients, they want what is the fertile period. So, best fertile period they are going to try or have intercourse in that time. So, to be honest, I don't say any particular day for them. As they are planning for pregnancy, anytime they can have intercourse, that should not be a problem. But if you have a good cycle, means 28-30 days, a predicted cycle, so you can predict the day of ovulation by the tracking the cycle. So, that is how we say it is fertile or unsafe zone, or it is it's a safe zone. That means you are not have to worry for pregnancy. So, fertile zone means when chance of conception is very high, that is usually in a 28-day cycle, 10 to 12 days, when your egg is fully mature and going to get ready for ovulation. So, that is around 12 to 14 days is the ovulation time, and after ovulation it stays living in your body for 24 hours, that is 1 day, and the sperm in going inside the, if you see the model, so after intercourse sperm deposits in the posterior part, it's the back side of your vagina, there is it's kind of a pouch, we call it fornix. So, there sperm gets accumulated and it is very much active for 2 days, that is 48 hours. So, even if your egg is released and on that day you did not have intercourse, still if you had intercourse 1 to 2 days before, that is also enough, because this active sperm will travel by a chemical reaction towards the egg with the use of your tube. So, for a successful pregnancy, good quality egg, open your tube and normal uterus is very important, and if your partner's sperm count is normal and good motile sperm is present, there is always a good chance of pregnancy, even if you are not having intercourse on the day of ovulation. So, you do not need to track particularly the day, which day you are going to ovulate, because people try using LH kit. I will say it will increase your stress level, that will cause period problem. So, better 10 to 12 days, that is the ideal time. From there to day 16, 18, if you have at least interval of 1 day, if you have intercourse, you are not going to miss your ovulation. And if you are not planning pregnancy, you want to use contraception, so if it is a barrier contraception or condom, you can use it. For this time, this is your ideal time, or you can copulate outside. Otherwise, in the first 5-6 days, in that first 5-6 days, 3 to 4 days is your period day, and after that 2 days, and just before your period again 5-6 days, that is the safe zone when it's very unlikely you will have your conception. So, but the thing is, if your period is not regular, then it is very difficult for anybody to have predict this. So, in that case, contraceptive pill to prevent conception is the best idea, and if you are not having a regular cycle, then chance of conception is low, because the ovulation is not happening properly. You should see your fertility specialist, who are going to guide you what to do then.